Mission and margin is the business of healthcare.
You've operated a captive domiciled here in the Cayman Islands for a really, really long time. How did that get started?
When we first started, it really was a difficult time in Texas, where it is the primary state that we operated in the United States. And tort reform was coming on board, but we were really looking at the cost of risk financing for us. And at that point, it had reached nearly $100 million a year. And we did get tort reform in Texas, which helped substantially as well. But we were able to save about $50 million a year in costs, but our costs are still running in that $50 to $60 million range annually. So we've had substantial savings during the time. That allowed us to take those monies and use those to help improve quality and safety across the system. And so several examples, we funded sim labs, so the simulation labs in some of the clinical settings where people could really work with clinicians in a more effective way to teach them risk scenarios and how they would engage and react to those in a more effective way. We also knew that nurses coming in had differing levels of critical thinking skills, so we began to test all new nurses in the system with a testing around critical thinking, and then developing development plans for those nurses as we saw areas of opportunity identified by that testing.
Would that have even been possible in the absence of an alternative risk financing model?
I've thought about that many times. I would like to think, yes, that we would have spent the money, but I think it would have been much more difficult to do because that would have gone through the usual budgeting process, which was fairly rigorous. Same sort of pressures annually to reduce spending, and this allowed us to have a way, but tie it very tightly to clinical improvement activities and say they have to be something that we think will reduce the risk for the organization, the captive's big concern, but do it in an effective way to improve patient care.
Watch, listen, or read Business of Healthcare interviews at bohseries.com.